Assemble the equipment needed. Preparing the equipment and materials needed saves time and effort of the nurse. We have to assess the hands. Nails should be kept short. Short nails are less likely to harbor microorganisms. Scratch a client or puncture gloves. Remove all jewelry. Microorganisms can lodge on jewelries and rings, and removal of jewelries can facilitate proper cleaning of hands and arms. Check the hands for breaks in the skin such as hangnails or cuts, to decrease the transmission of infectious organisms from the patient to the healthcare provider. Put on protective attire prior to beginning scrub. Pull arm sleeves up to shoulder level. This ensures that your sleeves would not be moist. Remove all types of hand, wrist, or arm jewelry. Jewelry can harbor microorganisms. First, wet hands and apply soap. Turn on the water and adjust the flow so that the water is warm. Warm water removes less of the protective oil on our hands. Wet hands thoroughly by holding them under running water, letting it run from the fingertips to the elbow. Water should flow from a discontaminated area to most contaminated. Apply 2 to 4 ml of liquid soap to the hands but hold hands higher than the elbows during this hand wash. Soap helps in lifting dirt, oil, and microorganisms from your skin, which is then removed when you rinse. Thoroughly wash and rinse the hands. Continue this motion for at least 15 seconds. Wash hands using friction on all surfaces. These motions create friction that help in removing microorganisms mechanically. Rub palms together. Hand over hand, finger interlace, washing between the fingers. Interlacing fingers help in cleaning interdigital spaces. Wash and rub fingertips against the palm of the opposite hand and vice versa. The fingertips are commonly missed areas that needs to be cleaned. Wash fingertips and nails individually. Wash thumbs and wrist. Wash beneath wedding ring if worn. Rinse hands tolerably by letting the water run from fingertips to elbow until the cleaning agent or liquid soap is removed. This allows the soap to be rinsed off from the cleanest to dirtiest area. Ready the scrub brush or obtain brush from dispenser. Obtain nail cleaner with hands. Nail file is used to remove dirt from the fingernail and fingertip. Clean beneath and around each fingernail with a nail file or orange stick under running water. Drop nail cleaner in sink when complete. Scrub first one hand as follows. Place all fingers of one hand together and brush across nail tips for 30 strokes to make sure all areas are cleaned. Mentally divide each finger and thumb into 4 planes and scrub each plane separately for 5 strokes to make sure we properly scrub all areas of our hands. Scrub the palm of each hand for 20 strokes using a circular motion. Scrubbing in circular motion with 20 strokes would ensure that we mechanically remove microorganisms from our hands. Scrub the back of each hand for 20 strokes using a circular motion. Using the same brush, scrub the other hand using the same technique as described above. Scrub first one arm as follows. Mentally divide one arm from wrist down to 2 inches from the elbow into 2 or 3 sections. This ensures that all areas are clean. Further divide each section of one arm into 4 planes. This will mechanically remove all microorganisms from our hands. Beginning with the section nearest your hands, scrub each plane with 5 strokes using a circular motion. Using the same brush, scrub the other arm using the same technique as described above. After which, discard or drop the brush in the sink. Rinse both hands and arms as follows. Flex your arms and rinse from the fingertips to the elbow in a single smooth motion, allowing water to drip from elbows. This ensures that hands are cleaned following the aseptic technique. Do not move arm back and forth under the water. Avoid splashing water onto the surface of the scrub suit or gown. This is to avoid contaminating the scrub suit or gown. Always keep hand higher than elbow to prevent water from running back from a non-scrub area to a scrub area. This is to prevent contamination. And then release water control and allow the water to drip from elbows for a few seconds before moving away from the scrubbing area. Go to the sterile setup area and dry hands. Walk backward into the operating room while keeping your hands elevated at waist level, with the elbow flexed in front of you but away from your body. This ensures that your hands does not touch any unsterile area. Walk to the table containing unwrapped sterile towel while keeping a slight distance from it to prevent touching any unsterile area. Pick up the sterile towel by its folded edge without dripping water into the sterile field. Allow the towel to unfold without touching anything to prevent contamination. Use one end of the towel to dry one hand completely using a rotation motion and moving from fingers to elbow. Dry hands from the cleanest to dirtiest area. Use the other end of the towel to dry the other hand and forearm in that order. This is to avoid transfer of microorganisms from elbow to the opposite hand. And then drop the towel into the designated receptacle. Put on the sterile gown. Pick up and unfold the gown. Identify the inner surface and pick up the gown beneath the neckband. Inside surface of gown will contact surface of skin and thus is considered contaminated. Avoid touching the sterile field or the outer surface of the gown. This is to keep sterile field and the outer surface of the gown sterile. Move away from the table, holding the gown away from body and arm's length to prevent the gown from touching any unsterile surface. Allow the gown to unfold from the top down. Do not let the gown touch the floor and avoid dangling the gown against unsterile surfaces to keep outside of the gown sterile. To complete the sterile gowning procedure, hold the gown just below the neckband near the shoulder. Slide both hands and work the arms partway into the sleeves until the fingers are at the end of the cuff but not through the cuffs. Careful application prevents contamination and the gown covers hands to prepare for close gloving. Have a coworker grasp the neckties without touching the outside of the gown and pull the gown upward to cover the neckline of your uniform in front and back. This is to secure the gown without contaminating it. The person tying the gown should take care to touch only the ties and not the front or sides of the gown. This is to maintain the sterility of the gown and making sure it is secured. Have a coworker hold the waist tie of your gown. Make a 3/4 turn, then take the tie and secure it in front of the gown. Or have a coworker take the 2 ties at each side of the gown and tie them at the back of the gown, making sure that your uniform is completely covered. To put on the gloves, you have to open the sterile wrapper containing the sterile gloves. With hands covered by sterile gown cuffs, open the inner sterile glove package. Sterile gown cuff will touch sterile glove surface. Put the glove on the non-dominant hand. With the dominant hand, pick up the opposite glove with the thumb and index finger, handling it through the sleeves. Sterile gown cuff will touch sterile glove surface. Lay the glove on the opposite gown cuff, thumb side down, with the glove opening pointed toward the fingers. Use the non-dominant hand to grasp the cuff of the glove through the gown cuff and firmly anchor it. With the dominant hand working through its sleeve, grasp the upper side of the glove's cuff and stretch it over the cuff of the gown. Pull the sleeve up to draw the cuff over the wrist as you extend the fingers of the non-dominant hand into the glove's fingers. Put the glove on the dominant hand. Place the fingers of the glove hand under the cuff of the remaining glove, following the sterile to sterile principle. Place the glove over the cuff of the second sleeve. Extend the fingers into the glove as you pull the glove up over the cuff. Adjust gloves for fit and comfort while maintaining sterility. This will keep the gloves secured and maintain comfort. To maintain the sterility when worn, sterile gowns should be considered sterile in front from the waist to the shoulder. The back of the gown is considered unsterile when it is not monitored by any member of the surgical team. The sleeves should be considered sterile from 2 inches above the elbow to the cuff, since the arms of the scrub person must move across a sterile field.